Welcome to the Healthy Heart Show, where we pull back the curtain on conventional medicine and dive into the root causes of cardiovascular health. If you are concerned about high cholesterol, high blood pressure, heart attacks, stroke, or atrial fibrillation, this is the place for you. We will provide natural heart information that will help you prevent, treat, and reverse any ailment, leaving pills and procedures out of the picture. Here are your guides to holistic heart health, board-certified cardiologist and Amazon best-selling author, Dr. Jack Wolfson, and natural heart doctor, naturopathic physician, Dr. Lauren Lattanza.
Hello, everyone. Dr. Jack Wolfson, board-certified cardiologist, and I'm here with Dr. Lauren Lattanza. And today we're going to be talking all about high blood pressure. So, Dr. Lauren, take it away. Tell us why so many people are affected by high blood pressure. What are the numbers of how many people have it?
So depending on where you find your statistics, it's anywhere from 50 to 25% of adults, in the US and globally can qualify as having high blood pressure. So I think that it's really a large topic that we need to kind of take a deep dive into. So taking the Healthy Heart Show into a new direction, just kind of breaking down these topics that we see every day. So I think we should kind of just take a crack at it. So if you would, maybe just elaborate, what is high blood pressure?
Yeah, so, blood pressure in general it's the amount of force that's exerted on the inside of the tube or inside of the blood vessels. And that tells us, again, the amount of force that's pushing against the vessels and also against the heart muscle itself. And that is typically reported as two numbers, a top number and a bottom number. The top number is the systolic pressure, or the pressure when the heart squeezes. That's the higher number. And then the bottom number is what's called the diastolic blood pressure. And that's when the heart is relaxed and hopefully the blood vessels are relaxing. The problem is oftentimes the blood vessels don't relax because of a variety of reasons we'll talk about, and therefore that number is higher.
So when patients come in, or when people just in general are thinking, okay, I need to check my blood pressure to find out, do I have high blood pressure? What is an ideal time for patients to be checking these numbers?
Well, blood pressure, I don't think should be checked too often because it's just a little bit much for people I've seen over the years that are taking their blood pressure 2-3 times a day. And then of course, a little bit of elevation leads to stress, which leads to a higher blood pressure, which leads to more stress. And it's a bad cycle to get into. I usually say 2 to 3 times per week and record those in a diary. The 2 to 3 times a week should be at different times of the day. So maybe one day you check it in the morning, one day you check it in the afternoon, and the other you check it, before bedtime or something like that. And that's typically when it's best. The rules that pretty much nobody follows is that you want to be relaxed when you take your blood pressure. You want to make sure that the blood pressure cuff, whether it's on your arm or it's on your wrist, ideally it's there for 5 minutes before you actually check. So if you're at the doctor's office and your blood pressure is high, again, the way that your textbook supposed to do it is to wait the 5 minutes with the cuff on your arm so you can get relaxed and get settled. And that's the best way to get the appropriate reading.
Great. I think that's really important information because it might seem very minute in having that cuff on your arm, but if you're somebody that's worried about your blood pressure, it's going to make it increase just by that little amount of stress of you thinking, okay, I've got this cuff slapped on my arm now, they're going to go for it, and that just raises you probably a few points. But what is considered to be high blood pressure in terms of the systolic and diastolic numbers you mentioned?
Well, the standard normal blood pressure is 120/80. That's always been the classic number. And certainly the lower the blood pressure, the better off people are. So the lowest blood pressure where you still feel good is typically the best. So if your blood pressure is 100/60, that may be great for you. 120/80 may be great for you. I think one issue is that the pharmaceutical companies, in an effort to push more pharmaceuticals, they keep lowering and lowering the blood pressure normal numbers. Therefore, it allows tens of millions of Americans and hundreds of millions of people worldwide to be considered hypertensive. Now, the issue really is that the higher the number over the longer period of time puts people at risk. But we should not be fearful in most cases about numbers that are 160 over 90, 156 over 86. We've got time to fix that, and I don't think it's an emergency to do so. So again, whatever your blood pressure is, the best number is probably somewhere in that 120 to 130 or below range. And again, we always want to look towards how can we make it better by going after the natural causes of this. And again, natural treatment solutions for the high blood pressure.
Right. And you mentioned that, the pharmaceutical patients, and a large majority of those patients still aren't even well controlled on those medications. So that's really where the root cause testing and identifying what's going on really comes in handy. What are some, are there symptoms associated with high blood pressure? Are there things that patients might feel of, okay, maybe this is my blood pressure kind of increasing that I need to be aware of?
I don't know what your experience so far has been, but obviously my experience over many, many years is that people really do not have symptoms from high blood pressure. If the blood pressure is markedly elevated, 220 over 110, 240 over 120, then people may start to experience symptoms, and that could be a headache, that could be shortness of breath, that could be chest pain, but those are really few and far between. So oftentimes people have symptoms, then they check their blood pressure and see that their number is high, and they'll attribute the symptoms to the blood pressure, when in fact the blood pressure is a reaction to the symptoms. So they get a headache, and the headache leads to elevated blood pressure, or they feel nauseous or feel like heart racing. Again, the high blood pressure at that moment is the result of whatever they're feeling, and it's not the cause.
Right. Yeah. So you might look up and say, look up a list of symptoms, and it might say headache or disturbed vision, maybe a racing heart, things like that, but it's often very silent, and you don't always have symptoms associated with that. So that makes it pretty dangerous. What are some of the risks that we might expect from having prolonged high blood pressure?
So, again, the longer that you have the high blood pressure and the higher the number is, yes, there is a higher risk of stroke, a higher risk of congestive heart failure, higher risk of heart attack, higher risk of kidney disease, eye disease, and ultimately even death from that particular problem. But really, it's kind of twofold. Number one is that the blood pressure itself, when elevated, can cause damage. But of course, whatever leads to the high blood pressure, whatever is causing that number to go up, the body's not making mistakes. The body is just reacting to its nutrition, its lifestyle, evidence, all these evidence-based toxins. It's reacting to deficiencies, reacting to excess of other things. And that, of course, leads to this response of the higher blood pressure. So ultimately, again, all that can wreak damage on the body. And as we'll talk about, the answer certainly is not pharmaceuticals.
Right. Yeah. And you mentioned like the kidneys and the eyes. So we really have to just kind of monitor these end organs and the microvasculature, because we have these large vessels and then it winds up in the very small vessels, which is really where you find the damage. So is there a way to measure the damage from high blood pressure?
Well, like you said, we can actually assess how the damage is happening if actually someone takes out their ophthalmoscope and look into the retina of a person's eye. And unfortunately, this is a lost art amongst doctors. They do not rely on this. But again, you can look at the back of the eye, the inside of the eye, and see changes to the blood vessels, as you alluded to. Now, most commonly, we can also, again, you can take a listen to the heart. You can hear an extra sound called a fourth heart sound. That's also seen in people with chronic high blood pressure, hypertension. And then we can also do an EKG. The EKG can show changes consistent with high blood pressure. A cardiac ultrasound known as an echocardiogram, that can show changes as well consistent with high blood pressure. And then what's really cool about some of the testing that we do is that we test for heart stress. It's a marker called the BNP. And I know you check this on all your patients as well. So we check the BNP. And when the heart is under stress from chronic high blood pressure, hypertension, that number will go up. When that heart stress number is in the normal range, I feel very comfortable telling people that we've got more time to deal with. It doesn't appear that there's changes that are happening to your body because of the high blood pressure. So let's take our time. Let's not stress out. Let's figure this out. Ultimately, sure, when people have high blood pressure for a long period of time, also that can lead to kidney damage. And we would see that as more of an end stage kind of thing where, again, their kidney function is reduced.
Right. Yeah. You mentioned the pro-BNP, and I often explain that to patients, and that your heart is this pump working against the high pressure gradient. So it's going to wear out and it's going to send stress markers out into the bloodstream. So that's what we're monitoring. So it's a good way to figure out how your heart is responding to that. So I know, and we will definitely get into how we here at Natural Heart Doctor treat high blood pressure, but what is the conventional approach to treating high blood pressure?
Well, listen, obviously for many years as a hospital-based cardiologist, I saw how typical medicine is done. And of course, when someone comes in, their blood pressure is high, boom, immediately they started on a pharmaceutical. And I can't tell you how many times I've seen people over the years that they were checked once, they were nervous in the doctor's office, blood pressure was high, they started on one drug, which led to side effects and beget, more and more pharmaceuticals. And that's just, unfortunate, where the doctors use a whole array of pharmaceuticals, and they're all problematic. They all have their risk. They all have their side effects. And again, the conventional medical doctors, they're not trained to go after the cause. They're not trained to talk about nutrition and lifestyle and environmental toxins and evidence-based supplements. They're not trained to give the body what it needs, take away what it doesn't. And it's unfortunate because it's the patients that, that pay the price.
Right. And the pharmaceuticals, yes, they lower your blood pressure, but I imagine that they also come along with quite a few risks. So maybe you can allude to some of those, that patients that have been on pharmaceutical drugs to lower their blood pressure might be experiencing these symptoms.
Yeah, I mean, again, beta blockers are a very common class. Those are the ones that end in -olol, like atenolol, labetalol, metoprolol, and those lead to a lot of different things. One is that they block adrenaline. So they lead to fatigue, they lead to exhaustion, they can lead to erectile dysfunction. They're very problematic. And those are often used, again, with other pharmaceuticals, diuretics, for example. Diuretics lead to loss of potassium, magnesium, and other nutrients. Calcium channel blockers leads to constipation and fatigue. The ACE inhibitors, angiotensin receptor blockers, again, that can lead to cough. That can lead to increased risk of viral pneumonia, for example, in people who use those pharmaceuticals. They can also waste zinc, which is also very important for the immune system. So there's so many different pharmaceuticals that are being used. They all have side effects, and ultimately they don't do what they're supposed to do because, again, they can lower the numbers down, but if they're not addressing the cause, they have very little benefit. If you look at the data and the research in the large blood pressure drug trials, they lower numbers down, but they have a very negligible benefit when it comes to preventing strokes, heart attacks, kidney failure, eye problems. And ultimately, it's not about how people can take a pharmaceutical to lower your stroke risk from 5% to 4%. It's about how can someone lower their stroke risk to 0%. And I think that's what you and I and the team at Natural Heart Doctor help provide.
Absolutely. And arguably, outside of making you feel better about having a lower blood pressure number, I don't know that there's really any benefits worth noting of any of these pharmaceuticals.
Right. I mean, listen, it's, none, the side effects on most of these are not positive. It's kind of interesting you bring that up. Again, like beta blockers can be useful for people with high blood pressure, especially when they have a large anxiety-driven component. They're, again, adrenaline is surging. Beta blockers can help that. There's a class of pharmaceuticals called alpha blockers, things like doxazosin and terazosin, and those can be helpful for men with high blood pressure who also have prostate issues. But ultimately, what we're all about here is that we go after the cause, and that's how people get the best results.
The Healthy Heart Show will be right back after we take this quick break to hear from our sponsor. Would you like to drink great tasting coffee that's also good for your heart health? Cardiology Coffee is your answer. This 5-star rated coffee is delicious. It's a gourmet coffee that begins with whole organic beans, hand-selected and carefully roasted. It's tested and certified to be free of pesticides, mold, and other toxins. Cardiology coffee is great for your heart, and you're going to love how it tastes. Order now online at cardiologycoffee.com. Now back to the Healthy Heart Show. Right, and I love how you always say you do not have a pharmaceutical deficiency. There is many other factors at work. So that's where we come in here at Natural Heart Doctor and get to the root of it. So maybe we can segue into what our treatment philosophy is here at Natural Heart Doctor.
Right. What you and I always talk about is that, you know, it's the whole concept of eat well, live well, and think well. And when we start to follow all that, that's where people get the best results. So we talk about this in a lot of other videos and a lot of different blogs. And of course, I mention all this stuff in my book. So when it comes to eat well, we're talking about organic, healthy foods without the chemicals. We're talking about hunter-gatherer diet as much as possible, live in that kind of Paleolithic lifestyle, plenty of free-range grass-fed meats, the wild seafood, eggs, nuts, seeds, avocados, coconuts, olives, vegetables and fruit in season. What we do is that we limit everything that's artificial. We keep our sugar content on the lower side. And again, always be organic and always gluten-free. I think those are two keys as far as the eat well is concerned. When it comes to live well, we want to make sure we get sunshine. Sunshine is very beneficial for people with high blood pressure for a whole variety of reasons. So get smart sunshine. You also, of course, you want to make sure you get decent sleep. Our ancestors went to sleep shortly after the sundown, and they woke with the sunrise. They watched the sunset, they watched the sunrise, and that's very medicinal. People who sleep 7 hours or less have a higher risk of high blood pressure, stroke, heart disease, you name it. And then ultimately, we go to see a doctor of chiropractic. We get adjusted. Chiropractic care is proven to lower blood pressure, 17/10. We make sure that we see a holistic and integrative dentist to make sure our teeth are taken care of. We make sure that we're physically active, preferably outdoors, doing activities that we love, hiking, biking, stand-up paddleboarding, skiing, gardening, outdoor yoga, whatever you enjoy doing, go outside and enjoy it. And then we definitely want to address the environmental toxins, because all of these environmental toxins, from air pollution to mold mycotoxins to plastics and phthalates and pesticides, all these things lead to cardiovascular issues. So we want to make sure that we address all facets of eat well, live well, think well. And as it pertains to think well, super critical. Mental and emotional health and wellness is so important. Find your happy, as we like to say at Natural Heart Doctor. It's helped so many people. Just the concept of, meditation, of getting stressful things out of their lives. We are not meant to be in this chronically stressed state. So we want to make sure that we get assessed there. Let me, circle back too, as it pertains to the sleep well. That's also a point where we want to make sure you do not have sleep apnea. You definitely, if you've been told you have high blood pressure, you definitely want to get tested for sleep apnea. There's natural treatment solutions for sleep apnea. Let's find out if you have it, and then we can work on fixing it.
Absolutely. So, so many cases of high blood pressure can be attributed to sleeping at night. And if you're not getting proper sleep, there's no way you're going to have, a proper mindset and everything kind of downstream. So it always starts with the foundational pieces: eat well, live well, think well. And that's, really just keeping in mind holistic medicine. We have to address the entire body, mindset, everything, all involved.
Hey, let me throw this back at you, because I know that you are certified in acupuncture. And let me ask you again, certainly the literature supports acupuncture use for hypertension, although we don't want to necessarily claim, again, we're not claiming that anything cures anything, lest we get in trouble with the authorities that are always monitoring us. But tell me, what is your experience with acupuncture in people with high blood pressure?
I often find that it's kind of these chronically anxious people that have high blood pressure, and that's where acupuncture just works incredibly well for them. So they've got, tinnitus, ringing in the ears, they're not sleeping well, and those are these chronically anxious people. So if we can help them, and I mean, we can talk about vagal tone and all of that. I mean, we can go in depth and probably have a whole episode on that, but when we're addressing the parasympathetic state, this kind of rest and digest, this calm state of your nervous system, that's really, I think, central, and especially these hypertensive patients, often anxiety driven, poor sleep, surge of cortisol and adrenaline, and all of this kind of coursing through the blood at all hours of the day. So if we can hone in on, a really a minimally invasive, 20-30 minute procedure like acupuncture a couple times a week, get them thinking better, sleeping better, in a better mindset, it really kind of just is like a relax button, and just kind of overhauls the system. So I've had really a great success with treating hypertension with acupuncture.
Excellent, excellent, excellent. So I know that, the next topic you want to bring up is the idea of test, don't guess, right?
Yes, absolutely. So what are we testing?
I mean, again, as we test, we want to make sure this whole idea of, eat well, live well, think well, and then we want to make sure that we're on the right path, and we want to make sure that we test and we don't guess. And in doing so, there's a whole variety of tests that we do, of course, that conventional doctors don't do. We want to make sure that we're, again, giving people the best information so they can get the best results. So we do, our first test is the advanced cardiovascular panel. And on the advanced cardiovascular panel, again, we're looking at markers of inflammation, oxidative stress. We're looking at advanced lipids. We're looking at hormones. We're looking at, again, thyroid and advanced blood sugar. So all those things that we look at intracellular vitamins and minerals. We know that magnesium and potassium are so important. Well, what are your levels? Do you need magnesium? Do you need potassium? Maybe you don't. What are your levels of omega-3? What are your levels of CoQ10? So again, the test don't guess really applies for all those. We do a test called the wheat zoomer, looking for leaky gut. When you have leaky gut, leaky heart, leaky gut leads to endothelial dysfunction, which ultimately, again, winds up leading to high blood pressure and the problems with high blood pressure. And then we do the triple toxin test, where we're looking for metals, mold mycotoxins, environmental toxins, really trying to dial in why someone has high blood pressure, because then once we dial in the why, now we can come up with a strategic plan to really help.
Absolutely. And, in all of those tests, which, I mean, there are so many markers, so much knowledge that can come through these tests, because there's so many nutrient deficiencies or toxin accumulation or everything that could really kind of factor into the patient's blood pressure. And a few other things that you didn't mention, but are on all of these tests, are testing for homocysteine elevations, or your omega-3 balance, and your cortisol, so your stress hormone, and of course your blood sugar, and everything that kind of factors into blood pressure, that probably most patients that have been put on a blood pressure pharmaceutical have not even been discussed with about, where are you on all of these markers? Is this something that we need to be considered with you? Why are you being put on this drug? So I think that there's a lot that's being left out in the standard treatment approach.
Especially too, like the people who are on pharmaceuticals. I mean, we see these people, again, the pharmaceuticals lead to deficiencies, lead to, low levels of magnesium, potassium, zinc is very, very common wasted, with diuretics and with ACE inhibitors. So that's where, that concept comes in. We talked again about all the different vitamins and minerals, and we mentioned before sunshine and the objective measurement of sunshine exposure. Yes, we can look at people and see if they're getting enough sun, but the other thing, of course, is also, again, just checking vitamin D and seeing what those numbers are. And to that end, the answer is not necessarily vitamin D supplementation. Right. It's getting the sunshine, eating animal rich and seafood foods that are high in vitamin D. We've talked again about the sunshine lamp, and we've got naturalheartdoctor.com, that /lamp, which is our recommended vitamin D lamp. And then you could supplement vitamin D as needed, typically in the winter time. Always want to make sure we add vitamin K. I recommend vitamin K to everybody and anybody, and I know you do as well. So
yeah, and I think that that's really kind of a good standard approach to, of course, diet. You want to make sure that most things are coming through your diet, and that supplements are used as just that, a supplement to, things that might fall short, or things that you just kind of, your individual body is not accumulating enough of, and so therefore you fall short in maybe magnesium and potassium particularly. So we need to support those in particular. What are some other supplements that might be really focal and central to the treatment of high blood pressure?
Well, I think you and I both know, and we've seen, again, as we read the medical literature, and it's all coming from the medical literature, that there's so many things that can help people with high blood pressure. But my standard approach is typically, hey, let's do things to boost levels of nitric oxide, really open up those pipes. And to do that, we hit from two different angles, one of which, of course, is the food-based nitrates, which is why we have the organic heartbeat powder. And we mix that in with our vessel support, which is L-arginine, L-citrulline, L-taurine, that crank up levels of nitric oxide. And then we add in grape seed extract, which helps prevent the breakdown of nitric oxide. So two different ways to increase nitric oxide levels. And we do that ideally in the sunshine. And that's a third way to increase nitric oxide levels. And then also the magnesium supplementation, our product Magna 5 with 5 different forms of magnesium, and our potassium powder product called Potassium Boost really helps to increase people's levels of potassium, which we find so many deficiencies. I don't know what your experience is, but I see just as many, if not more, people who've got the problem with potassium than they do magnesium.
Right. Yeah. And it's more than just on a standard metabolic panel. Like you might get just at your, general practitioner, we test the red blood cell potassium, which you and I know if it's deficient in your bloodstream, it's going to take it from neighboring cells, which is why it's critical to maintain that value. And yeah, the nitric oxide, again, something that we actually didn't mention when it comes to testing and not guessing. You and I both have on our desk these nitric oxide test strips so we can see where you are and exactly. And another thing that probably a number of patients have never had or even been discussed with in an office visit with their practitioner before getting a script handed to them for a prescription.
I can't tell you how many times over the years I've seen someone with high blood pressure or I've seen someone with atrial fibrillation or these other cardiac diagnoses. They didn't even have a serum or blood level of magnesium tested, let alone how we look intracellular. And a lot of times, right, the blood level is totally normal, but intracellular is reduced. So that's where, again, we really need to hone in, because if it's floating around in the blood, it's not doing any good. It's got to get inside of the cells, inside the endothelium, and that certainly helps. I think another one of our favorites too, into the supplements arena, when it comes to kind of all things cardiac, but certainly blood pressure, is Arterisol. 1 cap 2 times a day of Arterisol. It's got the patent for plaque stabilization and reversal. So that's a great product as well.
Absolutely. When we talk about, protecting the endothelial layer and how critical that is for supporting nitric oxide in the bloodstream, if I could have every patient on one supplement, it would be Arterisol. It's just huge. And that's something that is not just like a specific nutrient, but there is research on that supplement alone, which is actually very unique in the world of supplements.
Yeah, no, for sure. For sure. Well, definitely lots of great options that we can use. But, again, and that's where test, don't guess comes in, because again, you may not need magnesium. You may not need potassium. If we test your levels of nitric oxide and they're high, then we don't need to push, some of these other things. And again, there's so many other items that we could use, but invariably, which is great because we've got so many options to be able to help and support people. Eat well, live well, think well, and then ultimately test, don't guess, get into the evidence-based supplements, and from there, we're able to get rid of, people's pharmaceuticals, which is exciting.
Absolutely. And I think that that's the goal in providing hope outside of pharmaceuticals and not becoming reliant on that. So how can people get started? Where should people start working with Natural Heart Doctor to get their blood pressure in check?
Well, I think, is that the idea is that we can reduce or eliminate pharmaceuticals. That's always our goal, is getting people off of pharmaceuticals. And if it's your goal out there to get off the pharma, we'd love to be able to help you with that. And again, we do it in a smart and appropriate way. It's very easy for us to stop a statin drug, for example, and just say, well, stop the statin drug, immediately or cold turkey. But for blood pressure, we take our time. We would carefully wean people off of pharmaceuticals. Again, as they get healthier, we're removing the drugs and people continue to get healthy. So anyone who's interested, certainly reach out to us. Again, naturalheartdoctor.com, health at Natural Heart Doctor. We're here to help people in any way to be able to get to their best health. So again, Dr. Lauren Lattanza, I'm so appreciative of you and having you over here at Natural Heart Doctor, helping everybody achieve that 100-year heart. And I know when it comes to blood pressure, again, people are scared, people are nervous, people don't want to be on the pharmaceuticals, but they don't want to have a stroke. They feel pressured into the pharmaceuticals. And it's great that we can offer people a better way. So again, thank you for helping me share this information to the world.
Absolutely. And if you're listening to this, that means that you are in the right place. So reach out to us. We can do this safely and effectively. Root cause medicine is the way to go.
Cheers to the 100-year heart. We'll see you all next time on another episode, The Healthy Heart Show. We'll continue to bring you the best topics and, again, help you on your path to the 100-year heart. Be well.
That does it for today's episode. Thanks so much for listening to The Healthy Heart Show. Please help us get the word out by liking and subscribing to our podcast and our Facebook page, Natural Heart Doctor. Please show support for our podcast sponsor, Cardiology Coffee, your resource for organic, antioxidant-rich, mold and pesticide-free coffee shipped straight to your door. Learn more by adding @Cardiology Coffee on Instagram and visiting cardiologycoffee.com. This podcast provides materials for information and educational purposes only and should not be considered medical advice. We encourage you to contact your physician for any of the health issues discussed here.